Hi, I'm Bailey Perkins, State Advocacy and Public Policy Director for Oklahoma Food Banks.
Hi, my name is Stacy with Lighthouse Behavioral Wellness Center in Seminole, Oklahoma.
Assalamu alaikum. I'm Lanny Haybrock, Government Affairs Director for the Council on American Islamic Relations, Oklahoma chapter.
I'm Cassidy Height, Director of Communications and Strategic Initiatives at the Oklahoma Primary Care Association.
I'm Reverend Dr. Tiffany Nagel-Monroe.
Hi, I'm Kelly Steele, a therapist at Lighthouse Behavioral Wellness Center in Seminole.
My name is Robin Sunday Allen, and I'm the CEO of the Oklahoma City Indian Clinic. I'm excited about Medicaid expansion because it's the right thing to do.
I'm excited about Medicaid expansion because it just makes sense. It makes so much sense economically and in so many other ways. As a business strategist, I know it makes sense for business. As a citizen, I know it makes sense for citizens and taxpayers and individuals. I'm so happy about it.
It means that over 200,000 Oklahomans will now have access to health care.
I have one client who told me that he has not been to the doctor in 5 years. This reason is because he could not afford medical insurance.
So many of our neighbors will have the opportunity to have health coverage and go to the doctor without worry.
Because what it really means is an expansion of the quality of life for all Oklahomans.
Now that the state's expanding Medicaid, hundreds of thousands of Oklahomans will have access to the care they need,
including diagnostic testing and preventative care to get and stay healthy.
Medical, behavioral health, substance use disorder treatment and recovery services.
Basic checkups, basic dental care, and women's health services.
It's going to allow us to be able to provide collaborative care to enhance their physical and mental health needs. It will allow us to help them establish care with a primary care physician, as many of them have never had health care. I am very excited to see the progress that my clients are going to make with the new Medicaid expansion.
We here at Lighthouse are so excited for this expansion and to see our consumers get the health care that they deserve and collaborate with them in helping with their mental health care and seeing them get the physical health care that they need.
Now our most vulnerable populations have access to health care, with the end result being a reduction in health disparities and better health outcomes.
And by getting primary care when they need it, we can avoid countless cases of diabetes, hypertension, depression, anxiety. We can improve the lives of our neighbors, and we can make real strides towards reducing health disparities based on income, race, and insurance status.
It'll also keep so many of our hospitals open and able to serve more Oklahomans.
This means Medicaid expansion is an overall win for all of Oklahoma.
The passage of State Question 802, which brought Medicaid expansion to Oklahoma, shows us that if we form coalitions, if we get involved as volunteers, if we become advocates, we can accomplish something important.
There's no more important work that we have than to improve quality of life for one another. Way to go, Oklahoma. I can't wait to see how this changes lives.
I love that so much. Hello, everyone.
It just made me smile, almost brought tears to my eyes, Carly.
It almost brought tears to my eyes. Oh my goodness. Hello, everyone. Thank you for joining us this morning. My name is Carly Putnam, and I am the Policy Director at Oklahoma Policy Institute. I also did our healthcare work between roughly 2014 and 2020. So Medicaid expansion is a topic that's been near and dear to my heart for a long time. Angela, who are you?
Good morning, Carly, and everyone out there. My name is Angela Munson, and I serve as Outreach and Legislative Director at Oklahoma Policy. And this is really just an exciting event this morning, this celebration, and we should celebrate because for many of us, it's been a long and grueling route to making sure that more Oklahomans have access to health care. You know, I'm a believer that every single individual, Carly, regardless of their geographical location, their economic status, any condition at birth, whatever, should have access to high quality, affordable health care. And I believe that for a long, long, long time. So I'm celebrating extra beyond probably anybody else on this at this meeting this morning. I started this journey some 40 years ago. It's been 40 years this year as a staffer at the Oklahoma State Legislature, when federal funds did a big, huge cut in many of our community health centers, and people who were waiting then, 18 months to see a dentist, 6 months to see a doctor, were even going to have a harder time. So we started the fight to try to make sure that the state legislature appropriated necessary funds to continue the work of those clinics. And then in 1986, as the executive director of the Oklahoma Healthcare Project, then Families USA was Village Foundation funded consumer organization. We worked really hard for universal access to healthcare. And then 1991, as a member of the legislature, the first big bill I introduced was believe it or not, a single payer plan bill to ensure universal access to healthcare. So Carly, for 40 years this year, this has been a goal of mine to make sure that every single Oklahoman has access to healthcare services when they need it. And it has to be accessible to them. So I'm just celebrating. And if I could, and if I weren't so old, and if this were not a 40-year fight for me, I'd literally be turning cartwheels.
It hasn't been a 40-year fight for me, so I feel like I should be turning cartwheels, but I'm going to be kind to everybody on this broadcast and not do that. I feel like you've spent your full career working for this. I also have spent my full career working for this. It's just been a little bit shorter, perhaps. And the thing that I think you and I have both found as we've done this work for so long, that as much as this is about the really technical pieces, the really digging into regulations and statute, it's also just 100% about people. And whether it's the coalitions like the ones in Oklahoma that have been working so hard for so long to try to make this happen, or whether it's the individuals who will actually be getting care as a result of this, the people that we've all been working for. Fundamentally, Medicaid expansion and healthcare in general comes down to the individual people.
That's absolutely right, Carly. There's no way we could have made the progress that we have without individuals and organizations collectively working together. I can remember at the Healthcare Project back in the late 1980s, there were 121 organizations across the state that came together, worked really hard, and we were successful at the first real Medicaid expansion for pregnant women and children. The income eligibility levels were so low for families with dependent children. No one virtually, other than individuals who were then on cash assistance programs, could even qualify. So it was so important for us to do our first expansion for children and pregnant women. But it took all of those 100+ organizations to work really hard. And we saw that again here recently as organizations have come together to speak their collective voice, to bring their strength of their individual member organizations, their members together, to speak to legislators, to speak to the general public. And then, Carly, to bring in all these individuals who signed petitions, who went to vote. Obviously, our hats are off to them. A collective huge thank you to every individual in Oklahoma who understood the importance of Medicaid expansion, who understands the importance of seeing a physician, being able to go to the doctor, individually the importance, but collectively on our communities. So the focus has been on people, one person at a time, who needed health care, whose lives are important to us, that one individual whose life matters. I just want to say congratulations to all of you who made this happen.
Absolutely. And I'm so excited that we get to kick off this morning's event with some of those stories from some of those people. We've been working with partners in our Cover OK coalition and others from around the state to collect stories from the individuals who will be those most affected by Medicaid expansion. And I hope you enjoy them as much as we have.
Hello, my name is Gwen Weintraub. I'm 56 years old, and I have health problems for about 6 years now, and I'm really ready to get this insurance.
Yeah, my name is Tim Weintraub. I'm 54 years old. I never had insurance, and I'm looking forward to getting some so I can go ahead and take care of what I need to take care of before I get any older.
I haven't had insurance ever, and with my health problems, I really needed it to get the care that I need, and I had to do without because I didn't have insurance.
You know, she went to the hospital every time we went to emergency room. You know, it just racked up money. You know, and it was real hard and difficult to keep going to the emergency room instead of just going to a primary doctor, and it was hard, you know,
and I was going a lot, like 3 times a week. I had to go to the emergency room.
Yes, and I have asthma too. I've been having it for a long time, and like I said, a couple of little procedures done that this will help for getting this insurance, and it will help me really a lot. I won't have to be stressed and anxiety to go to emergency or go see the doctor or that, you know, so I can have something to, you know, feel confidence that they will help me and, you know, not, embarrassed to say I don't have any insurance, and just think that I will get it the first and help me get through some of my anxiety and problems and try to get better in life.
We have aged quite a bit, and we really need more health care than what we've been getting.
Yeah, I think it would do a lot of Oklahomans good to have insurance finally. A lot of people don't go to the hospital because they don't have insurance, so they just stay at home and suffer and just try to deal with it. But now that people have, will have it, it'll help a lot of people out, older and younger people.
We've been telling everybody that we know, if you don't have it, try to get it.
I hope it helps a lot of people, and just get on the right track and just tell all people. I try to tell my brother, he didn't know what I was talking about, but now he does, so he's going to sign up and do what he has to do to get it.
Like I said, we're up in age now, and we have some health issues that really need to be tended to, and I just thank God that we're finally going to be able to get some attention. Maybe we can hold our good looks a little longer.
Hi, I'm Danielle Gaddis, and I'm one of the many Oklahomans that will be insured coming up soon. So a little bit about me. I graduated from Southern Nazarene University back in 2017. And then I just graduated from Case Western Reserve University with my master's in applied anatomy with hopes to start medical school next year. I've been in the health gap for about 2 years. So I had originally insurance through my parents' insurer. But when she retired and lost that insurance through them, I lost my insurance as well. The most challenging part about not being covered under insurance is when you get something as simple as like a flu or a high fever, maybe strep throat, and you can't go to the doctor because you know that the visit itself is going to have not a copay, but a full payment that you're going to have to come up with. And you're going to need antibiotics or something to fight that. So the cost is going to be included there as well. And it puts you in a really awkward place when it comes to getting care, because you have to wait until it's really bad to go get care because cost is an issue. As a future healthcare provider, it's important to me that everyone gets the care that they need. It's important that everyone, meets that basic level of care that you need to sustain a healthy life that you can be happy in. But for me, myself, it was something that I couldn't get. So it was a really hard situation to balance out, really think about. And, now that I have it, or I'm going to have it, it means a lot to me, because as someone who's going in to serve and help people in that system, particularly because I want to work with people that are underserved, to be covered by that insurance plan right now, I'm going to get a taste of what my future patients will get. There might have been some misinformation about the expansion of Medicaid, but it is actually very important. It covers that random gap in between of people that would qualify regularly because of their income, and the people who make a little bit too much. So it covers some of the people that made a little bit too much before, and it allows for people that, you know, really couldn't afford the medications, the co-pays, the paying for insurance monthly, to have insurance that they can actually afford. So it's very important that this expansion happened, and I'm very excited that, you know, most of the people in Oklahoma agree that it should happen, because, you know, healthcare is something that everyone should have. It's something that everyone should have, regardless of their race, ethnicity, their social class. It's something that everyone should be entitled to, because health is something that makes life worth living. Good job, Oklahoma, on expanding Medicaid. It's very important that we do this, and I can't wait to come back after medical school to participate in the care that will be given to patients because of this expansion. Good job.
I'm pretty excited just to see like the difference, and allows me just to come and see y'all more frequently and deal with some of my issues. I'm hoping that that allows me just to get my sleep under control and my food under control, as well as like just being in a better mood in general. It's nice just to get my teeth looked at, as well as establishing just general care. I haven't seen a doctor in a few years now, so it'd be really nice just to see where I'm at with everything, as well as working on my physical health, such as exercise and stuff, because like I'm pretty far behind as far as I know. More like that sort of interaction helps me to focus, and like I feel properly awake when I can go somewhere and do something like I used to work and stuff. But work is unrealistic right now, like, you know, falling and crying and stuff. It's not very practical for work. That structure around me allows me just to move forward with everything. Probably getting my life under control. Medicaid expansion will help me focus more on what I need rather than what I want.
I'm so thankful for Medicaid. I can actually go see a doctor now. I've been in pain for over 5 years. Not being able to see the doctor was terrible. Now I can see a doctor, and I can get my teeth fixed. I can go get my glasses. I'm so thankful for this. I feel very blessed. I know that I'm going to be helped now finally. After all this time, I'm going to get help, and I am thankful. Everybody else should get this too, so they can be helped just like me. Thank God we got this, and bless all of you.
Wow, Carly. We're changing lives. Not us individually, but this whole system is changing lives.
That Oklahomans came together to say yes to this is just so wonderful and gratifying. Oh my goodness, I love those videos. I hadn't seen some of them before, and I do think it made me tear up a bit.
Well, I have not seen any of them. And you know what they say to us over and over again is healthcare truly is a basic human right.
I especially loved all the people who emphasized that when they finally have access to the care that they need, so many other things that they'll be able to do. Healthcare shouldn't be a reward. Healthcare is so foundational to being able to do everything you want people to do to make us the state we know we can be.
That's absolutely right. Sick adults can't work. Sick children can't learn. So it is basic. Thank you so very much, all of you again. I just can't say thank you enough for all those Oklahomans like Emma, right, who worked hard, put forth a huge effort to make this happen.
We brought Emma on board to the OK policy team just about a year ago, and watching her take ownership of this within our organization at the same time that Oklahoma is taking ownership of Medicaid expansion has just been phenomenal. Emma, you want to introduce our next slate of speakers?
Yes, absolutely. Like I said, my name is Emma Morris. I'm the Healthcare and Revenue Policy Analyst at OK Policy. And like Carly said, this is fundamentally about people. And so I always love hearing those stories about how, the lives of people, of Oklahomans are going to be impacted starting tomorrow. So I have the honor today of introducing our incredible speakers. Like Carly and Angela mentioned earlier, it's been a really long road getting to this point. Tons of advocates have been working to protect and expand health coverage in Oklahoma for years. The Cover OK Coalition, which is made up of organizations all across the state that are passionate about expanding that access to care, has been particularly important in these efforts in the last few years. Individuals and groups across the state have come together to coordinate and collaborate and make sure that Medicaid expansion could actually be a reality in Oklahoma. Members of this coalition truly care about the well-being of Oklahomans, and it's been my honor to work with them over the past year. So we've already heard from two of our fiercest advocates, and now we get to hear from two more. Two people who fought tirelessly to get Medicaid expansion over the finish line in Oklahoma. Two people who were instrumental in ensuring that 200,000 Oklahomans will now be able to see their doctors without worry. So first, we're going to hear from Amber England, the campaign manager for State Question 802, and then we'll turn it over to Patti Davis, the president of the Oklahoma Hospital Association.
Hello, my name is Amber England, and I was the campaign manager for State Question 802. And being the campaign manager of such an important initiative petition that won healthcare for almost 200,000 individuals across the state of Oklahoma is really the honor of my professional career. I don't think that I will ever be able to be involved in something that will have such immediate impact in the lives of so many Oklahomans. And I still try to, as I think back to that night, almost a year ago, actually it'll be a year ago today, that it just feels very surreal that we were able to actually do this. I was actually in Washington, D.C. At a meeting the day that the Supreme Court upheld the ACA originally. And I was there with a lot of child advocates, and we rushed over to the Supreme Court. I actually remember watching Pete Williams with NBC file his report from the steps of the Supreme Court building. And so, all of us came home, and then I remember getting in a room at the Hospital Association with many advocates who were involved from the beginning, folks like Patti Davis and David Blatt and Wes Glinsman, those Oklahoma advocates that were in it from day one, trying to strategize how were we going to get the legislature or the governor to accept these Medicaid expansion dollars. I was pretty naive at the time and thought, we'll just get it done the next session. And it took almost 10 years to actually make that come to fruition. And so I think that's just such a testament to the strong will and perseverance of Oklahoma advocates for this issue, but also a lesson in things just don't happen overnight, and you always have to continue to fight. But as I think back to the last 2 years of this campaign, we filed in April of 2019, and then quickly were challenged in court. We won that court battle unanimously the same day that it was, not unanimously, but fairly unanimously, but almost the exact same day that the court heard the arguments in the case. And then we quickly went to work on signature collection, and we had about 90 days to collect 168,000 signatures. And we actually blew past that record. We collected signatures from every single county in the state. We turned in the most state signatures in state history for an initiative petition. That's work that I'm very proud of, but would not have happened without everyday Oklahomans coming in, picking up a clipboard and a pen, and doing their part to get this on the ballot. Fast forward to March of 2020, when the world sort of stopped turning and COVID hit and everything shut down. We were in the middle of the campaign, still didn't know when our election date was. That was up to the governor. We had cleared all the hurdles, but we're waiting for him. So we moved everything online. In that first couple of weeks, we just were trying to figure out what to do. And We just said, look, we're going to have a healthcare happy hour online and just see who shows up. Not expecting a lot, but that night over 100 people showed up online to see what they could do from home. Every single advocate, volunteer, organizer was bought in on this campaign from day one. And so when we won on June 30th of last year, it really did feel like this victory belonged to everyone in the state of Oklahoma. I've never actually been involved in a campaign that felt as grassroots and just was so incredibly important to so many people. And so it just really felt like such an honor to bring that victory home for so many people. And then to see once we started this year with implementation of the law, starting on June 1st, when people started signing up, but to have over 100,000 people sign up in the first week of enrollment just speaks to, quite frankly, the desperation of people who were just needing healthcare and who had been waiting and waiting for politicians to act for almost a decade. And politicians never did act, but the people of Oklahoma knew best that it was important for us to bring back over $1 billion of our taxpayer money and to make certain that almost 200,000 of our friends, families, neighbors got access to healthcare, and now we're here. I also think that it's important to understand that just because we won Medicaid expansion for almost 200,000 Oklahomans does not mean that we can just rest on our laurels and that this victory is forever. We have to protect this victory. You have to make certain that the legislature and the rulemaking bodies actually implement this law with the way the voters intended. We also have to make certain that those folks who are angry or upset about the ballot measure process, we're seeing this across the country, many legislatures where we've seen policies passed that help everyday people, like Medicaid expansion, other issues that are helping working families, are under attack. The ballot measure process is under attack, and we need to protect that. We need to make certain that Oklahomans can decide issues for themselves when the legislature or the governor will fail to do it for them. And so I would say, as folks out there paying attention to this, just celebrate this victory, know that our hard work paid off, but know that we can't rest, that we have to continue to protect what we won and make certain that we have the right to use our voice at the ballot box moving forward. Thank you so much. Again, it was such a pleasure and an honor to be involved in this campaign, and I'm really excited to see what's next.
Hi, I'm Patti Davis, President of the Oklahoma Hospital Association, and I'm so pleased to be joining you today, even though it is with a recording. So, after almost a decade of trying to get Medicaid expansion done at the state capitol, June 30th, 2020, almost a year ago, the people decided it was time to expand Medicaid. Oklahoma was the 37th state to expand, but we're the first to put it in the state's constitution. But it seems like it's been years since we started our initial conversation with stakeholders in the fall of 2018 until today. State Question 802 had tremendous grassroots efforts, gathering signatures from all 77 counties to let the people decide. The Oklahoma Hospital Association conducted a grassroots campaign inside the State Question 802 campaign. Our leaders rolled up their sleeves and got to work. From county fairs to car shows, festivals, and other community events, dedicated hospital advocates carried around clipboards. We have some really great photos of hospital CEOs donning Bermuda shorts and doing their parts to get signatures in the heat of the summer. There were even contests between CEOs regarding signatures. One very creative rural hospital CEO actually went to a back to school event and quickly sent a packet back with several pages of signatures to support Medicaid expansion. We were very pleased to turn in a record number of signatures, and on behalf of only being a small part of this coalition, we couldn't have been prouder with that extraordinary effort. And we know that was done with paid signature gatherers, but a lot of very dedicated and passionate volunteers as well. We survived a Supreme Court challenge and then the pandemic. As hospitals pivoted to providing care of the pandemic, the association had to focus on putting together a hospital surge plan. Not only one surge plan, but we had to revise it 3 times. We learned that the governor had chosen June 30th as the primary date for the election, and the pandemic was of utmost concern. We understood that there was a tremendous need to stress absentee ballots for those fearful to go to the polls. And then there was another Supreme Court challenge on notary requirements on absentee ballots. We were not successful in court, but we were successful in the end. Oh, and I must mention, during early voting, Oklahoma experienced very poor air quality due to sub-Saharan winds. So we had dedicated voters that were waiting in line to vote when we knew that health-wise it was probably very difficult for some. But Oklahoma voters came through. To pass Medicaid expansion in a very conservative state during a pandemic will likely be the high point of my career. As enrollment efforts continue, it is with great pride that the Oklahoma Hospital Association and our members were all in on this effort. This is the right thing to do for 200,000 hardworking, low-income Oklahomans. This is the right thing to do for those in our community who are less fortunate. This is the right thing to do to improve health outcomes. Now, tomorrow, July 1st, 2021, will truly be the official date when many Oklahomans can now be covered. On behalf of our entire coalition, we can collectively take a deep breath and say, we did it. And I applaud you all. Thank you so much, and thank you for tuning in.
Thank you so much to Amber and Patti for sharing those words of encouragement and action with us. And while we've already heard from several advocates today, I wish that we had the time and the space to thank every single person who collected signatures, talked to friends and family members, and helped get out the vote. Like Amber said, this is a celebration of a collective community effort. It took every single one of us to make this happen. So as we celebrate the hard work of advocates over the last decade today, let's also celebrate what expansion means for members of our communities. All Oklahomans should be able to see their doctors or to fill their prescriptions. Oklahomans shouldn't worry that basic health care will result in financial ruin. And Medicaid expansion is a great first step towards making that a reality. So now let's hear about how expansion will make our communities healthier. First, we'll hear from Sarah Riven of the American Heart Association, Charlie Gagen of the American Lung Association, and Dana Bacon of the Leukemia and Lymphoma Society to discuss the importance of life-saving prevention and treatment. Then we'll turn it over to Lisa Turner of the ARC of Oklahoma and Whitney Cipolla from Mental Health Association Oklahoma, who will tell us what expansion means for people with disabilities and for Oklahomans who need mental health treatment.
I'm Sarah Riven, the State Government Relations Director for the American Heart Association.
I'm Charlie Gagen, the Advocacy Director for Oklahoma for the American Lung Association.
Good morning. I'm Dana Bacon, Regional Government Affairs Director for the Leukemia and Lymphoma Society.
Doctors have seen far too many Oklahoma patients with heart conditions go without surgery or medication because they cannot afford it. When someone is diagnosed with a heart condition, our doctors shouldn't have to weigh whether to provide life-saving care with whether or not a patient has insurance and can pay. So the American Heart Association is thrilled to celebrate Medicaid expansion and will now be providing access to healthcare to 200,000 more Oklahomans.
Medicaid expansion provides access to preventative services and ensures that people have access to services like cancer screenings and tobacco cessation treatment at no cost. Lung cancer continues to be the leading cause of cancer deaths, and Medicaid expansion will cover screenings for lung cancer, which can reduce the lung cancer death rate by up to 20% by detecting tumors at early stages when they're more likely to be curable. Additionally, with 1 in 5 adult Oklahomans and 3 in 10 high schoolers using tobacco products, access to tobacco cessation is incredibly important. Oklahoma already has some of the best Medicaid tobacco cessation coverage in the nation, and now it'll be accessible to thousands more Oklahomans. This includes different forms of counseling as well as FDA-approved medications. On behalf of all Oklahomans with chronic disease, we want to thank and congratulate Oklahomans for taking this important step to expand Medicaid.
We're all here this morning because we're so excited about what Medicaid expansion is going to mean for Oklahoma. For me, when I think about Medicaid expansion and blood cancer patients, what comes to mind is some of the stuff that we've heard Charlie and Sarah talk about. It's hard to get the care you need if you can't afford it. And sometimes it's great if you can catch a disease early because it means it's more treatable. For blood cancer patients, though, prevention and screening isn't really useful compared to being able to afford life-saving medications. There are more than 2,000 Oklahomans who are going to get a blood cancer diagnosis this year alone. And for those Oklahomans who are now able to go on sooner care, that coverage means that they're going to be able to afford treatments that are going to save their lives and help them restore their full health. I'm very happy for that.
This is undoubtedly an important step for Oklahoma and will lead to a healthier Oklahoma. We are so excited and congratulate Oklahomans on this important step.
Hi, my name is Lisa Turner. I'm the CEO of the Arc of Oklahoma, a nonprofit organization advocating for and with people with intellectual and developmental disabilities and their family members. Many people think that people with disabilities don't need access to Medicaid, but the fact of the matter is that they do. And Medicaid expansion is another venue that opens up the door for these individuals to get the critical healthcare services that they need. We're so happy to see Medicaid expansion here in Oklahoma because it means access to health and well-being for individuals with disabilities, their family members, and their direct care professionals in the community. We know that states that have already expanded Medicaid have experienced significant savings in services to people with disabilities, important savings that could be used right here in Oklahoma to expand home and community-based waiver services, a program that right now has almost 5,800 Oklahomans on a waiting list, averaging 13 years for those individuals to receive critical supports to live at home in the community rather than institutions. Expanded Medicaid eligibility also means other people with disabilities who previously would not have qualified for Medicaid now can and can have access to consistent and reliable health care. In addition, their family members and caregivers whose income may have exceeded the Medicaid guidelines before expansion now have access to the care they need, and that leads to a healthier Oklahoma. And now I'd like to introduce Whitney from Mental Health Association, Oklahoma.
Thanks, Lisa. Hi, my name is Whitney Cipolla, and I'm the Advocacy Specialist with Mental Health Association, Oklahoma. Here at the association, we believe Medicaid expansion is one of the best things to happen to our state for Oklahoma's overall health and mental health. Based on the passage of State Question 802 in 2020, for the first time, adults will be eligible for Medicaid services based on income. There are already over 100,000 adults who have been approved for benefits through Medicaid, with coverage beginning on July 1st for expansion. Oklahoma currently ranks 41st in the nation for adult mental health. More than 200,000 Oklahomans are newly eligible for affordable health coverage, including some of the 92,000 uninsured adults with a mental illness in Oklahoma, and a number of the 248,000 Oklahomans who had a substance use disorder within the past year. While the state has always had a system for the indigent, it has never been appropriately resourced to serve everyone in need. Therefore, many people didn't have immediate access to care that would help prevent them from reaching a crisis point. If eligible people enroll in Medicaid expansion, they can receive assessment and treatment before it turns into a crisis involving law enforcement, incarceration, emergency rooms, or homelessness. Not only will this save lives, but it will keep families together, reduce trauma from interactions with systems ill-equipped to handle mental health crises. It will also help people maintain employment, and it will save the state money by prioritizing less expensive preventative care over crisis services. Additionally, in the midst of the COVID-19 pandemic, ensuring access to behavioral health care has never been so important. Projections show that as a result of the pandemic, there will likely be increases in deaths due to opioid overdoses, thoughts of suicide, suicide attempts, deaths by suicide, and rates of alcohol and drug addiction. Adults covered under Medicaid expansion are more likely to receive substance use disorder treatment and have better overall health. Many Oklahomans have been going without necessary health care, particularly mental health care, for years. By increasing access to care for Oklahomans with mental illness, we will see more stability in employment, housing, and families, less utilization of crisis services, and improved mental and physical health outcomes. I'm looking forward to seeing the benefits of Medicaid expansion in the behavioral health space, and I want to thank you all for celebrating the implementation of Medicaid expansion with my friends at Oklahoma Policy Institute and with me.
Thanks to Sarah, Charlie, Dana, Lisa, and Whitney for that discussion. This is truly an exciting time to be an Oklahoman. In our state, we often talk about the Oklahoma standard. We point to times that we've come together to help each other out. We think back on instances where we've relied on each other to get through something hard. And this is one of those times. Expanding Medicaid will help so many Oklahomans, and we should be proud that we did this together as a community. So lastly, we're going to hear from Steve Goldman. Steve is an Enrollment Navigator, which means that he helps people apply for health coverage through Medicaid and the ACA marketplace. He spends all hours of his days individually helping Oklahomans apply for and access the coverage to which they are entitled. Steve is the Oklahoma standard personified. It's been my honor to work with him and to learn from him over the past few months. And today he's going to discuss a few other reasons to be hopeful about what Medicaid expansion will mean for our state, as well as how folks can apply. Take it away, Steve.
Hi, I'm Steve Goldman, Healthcare Navigator with Legal Aid Services of Oklahoma. Sooner Care provides medical and behavioral health care for about 1 out of 4 Oklahomans. That's over 1 million each year. But there's been a big missing piece, a big group of people that were not being helped. And that's being fixed with Medicaid expansion to more adults starting July 1st. Oklahoma is expanding Medicaid to low-income adults, joining the 75% of other states who've already done this. Why does this matter? Who does it help? Why is it the right thing to do? The Medicaid expansion makes Oklahoma competitive with other states for companies looking for a healthy, productive workforce. It means more jobs in the healthcare sector, which avoids the boom and bust cycle of other parts of the Oklahoma economy. Who does it help? It helps the young adult who keeps Sooner Care coverage after age 19, so they stay on their asthma inhalers, for example. It helps keep families together, as Sooner Care expansion brings behavioral health services for the stresses and strains inside families, even substance abuse treatment. It helps Oklahomans stay in their home rural areas, since expansion supports rural hospitals that have been on the edge of closing in recent years. Rural areas also have smaller companies that may not offer health plans. So along with the ACA marketplace, Sooner Care expansion lets Oklahomans live rural, not have to move to a big city just for a job with health coverage. So many Oklahomans work part-time because of their responsibilities to care for children or elders. Sooner Care expansion means these vital caregivers will have their own health needs covered so they can continue taking care of others. Staying in treatment and on medications is so important for good outcomes, both medical and social. Here are 2 examples. About 1/3 of adult Oklahomans walk around with pre-existing conditions that are easily treatable, like high blood pressure or diabetes. Now with Sooner Care expansion, they can stay on therapy even as their income changes, staying healthy for their family and ready for their next job. Oklahoma still has a high incarceration rate. Sooner Care expansion means adults leaving prison can stay on their medications to have a healthy transition to family and their community. Sooner Care expansion helps the state. Just like roads and bridges and schools, the federal government sends money to the state, much more than what the state puts in. At the start, Medicaid expansion is paid 90% by the federal government and just 10% by the state. This means helping Oklahomans' health and well-being, keeping families together, maintaining health across all ages, and offering a productive workforce. Oklahoma is still new and full of possibilities. Oklahoma was one of the last 5 states to be created, and even though Oklahoma has been in the bottom 5 in health rankings for years, Sooner Care Medicaid expansion brings medical and behavioral health care that's needed now for a brighter future for Oklahoma. A Sooner Care application can be done anytime at this website, mysoonercare.org. Again, mysoonercare.org. Or you can call Sooner Care at 1-800-987-7767. That's 1-800-987-7767. There's also information about Sooner Care and the ACA Marketplace in Oklahoma at this website, myokplan.org. Again, myokplan.org. Thank you.
Hey, Carly, lots of good information out there.
So much good information. It was so wonderful to end by hearing from Steve, who has been such a tireless advocate in this space for so long, and also knows absolutely everything about health insurance.
I tell you, he's one of the smartest guys I know. I've known Steve for quite some time, and I've actually had a wonderful opportunity to watch him work with individuals that needed to be enrolled in the expanded Sooner Care program. And he's so calm, he's easygoing, encouraging. He's all those things that people are a bit nervous about this process need, because some people think that enrolling in what they consider a public program is quite intimidating. But, I just remind folk, Medicaid is a tax-sponsored our tax-sponsored program. It's a good way. It's one of the best uses of our public resources. And Steve hit it when he said, enroll. If you need coverage, enroll, because that is what it was designed for. And, there were a couple of things, Carl, I want to mention this. Steve mentioned, others mentioned the economic boost. So it's not just something to do because we're altruistic and we love people and we know the value of healthcare. I used to make the argument always, if you don't believe in any of that, believe in the economy and the importance of shoring up the economy. And it brings a whole lot of federal dollars back to Oklahoma. So it's really, really important for people to recognize the stabilization that it provides, not just for families and individuals, but for our entire communities and for this state. So, I'm just so happy for Steve and all those that have been on. I want to give you a chance, of course, Carly, to talk. I know you had lots to say, but I want to come back before we go and really tell folk out there ways that they can get involved.
Yes, I'm so excited for all of this. With coverage start taking effect tomorrow on July 1. So many of the folks that we heard from in the very beginning in those early videos will finally be able to see a doctor and get the care that they need. But certainly I want to come back to something Amber said in her video, which is that as momentous as this is, we can't rest on our laurels. We know that this is our program. This is a program that's funded by us with our dollars that Oklahomans made the choice to expand. And we know that it's our responsibility to help protect it, to ensure that throughout the topsy-turvy nature of the state budget and the legislature, that Oklahomans continue to be able to see a doctor and get the health care that they need. And for more information at okpolicy.org/countdown, I think something Angela pointed out that was really prescient, which is how intimidating applying for Medicaid can seem. And with Steve and with the Cover OK Coalition, we've put together an enrollment guide that is just the coolest thing. I was so excited to get to page through it, really trying to break down all of the steps to help Oklahomans claim their health care.
You know, Carly, a lot of people are nervous about, again, this enrollment process. That enrollment guide is so quite helpful. There's actually even a video that if people needed some help that they can watch. But, you know, because enrollment is better on the internet, you can make a phone call too, because not everybody has access to a computer. So make sure they call that number. It's showing on the screen. Jot it down. Share with your friends, your family members, whatever you can. Get the word out there that you can call. And there are people who will take your information and enter it into the computer for you. And what we're looking for at OK Policy as well are organizations across the state who may say, you know, we have a responsibility one for another. So whether it's a church or sorority or fraternity, some community neighborhood association, whether it's any kind of organization, community-based organization out there that really wants to get involved in this, we have an opportunity for them. We will teach you, we will train you. You can set up, join with your local library even. There are bank of computers at libraries. So just go there, be there, work with them, and be around to help encourage individuals to go online at the library and fill out their Medicaid, their Sooner Care applications. So set up a booth at a local grocery store. Identify in your communities where people go, where people are who really may need health coverage. And we can make those connections with you, with others in your community who might want to share in reaching out to individuals who need this care. The one thing that we definitely don't want to happen, Carly, in Oklahoma, after all of these years of making this investment in such an important policy change, is for people not to take advantage of it. We know that's probably not going to happen given the enrollment levels to date, but there are, just like other things, the census, we know that there are hard to reach population groups. So it's going to be extraordinarily important for us to identify those hard to reach population groups, make them feel comfortable with the process, maybe take their hand, lead them down the path to really making improvements in their lives on a daily basis. So if somebody has some interest, there's that okpolicy.org/countdown. You know, go there, send us a message, let us know. We'll be happy to get back with you. Many of us are making calls to organizations across the state saying, hey, we need you. Join us in this effort to make the reality that we worked so hard for so long real in people's lives across the state.
Absolutely. Head to okpolicy.org/countdown for all of that info. In addition, if you've got a healthcare story to share, and we know that everyone has a healthcare story to share, you can go to okpolicy.org/mystory to share that as well. We know that hundreds of thousands of people are going to be really, really profoundly affected by this, and we want to be able to document and to celebrate that. OK Policy is, and all of the partners that we've worked with, we're so happy to see that we're here.
You know, I hope there are those who are watching and will continue to watch, because this video will live on forever on our Facebook site and YouTube site and some other places. So it will encourage those, and I'm gonna make some calls to people who joined me 40 years ago in this fight and say, hey, watch it, you should celebrate. So it's a great day in the neighborhood. Tomorrow will even be a better day, July 1. Well, all those individuals who needed healthcare services, who really needed it, not just the one. I think one of the speakers said, you know, it's not just something I wanted, but this is something I really needed. So when tomorrow rolls around, it'll be another big party as people can get prescriptions filled. People can see doctors. A friend of mine who was one of those early enrollees said, you know, I had a June 30th doctor's appointment. I think I'm going to put it off till after July 1. And we smiled. Fortunately, they could wait a little bit. And then she says, but for sure, any prescription I have, I'm going to wait till after July 1 to get filled. Because that means the difference between food on the table, paying electric bill. It means the difference between paying a rent, paying mortgage. So this really is a life-altering public policy change. Now, all those people, all those organizations, who voted for State Question 802, who signed the petition, who get people to sign petitions, who've done a call, made a call to a legislator, whatever you did. I just personally want to say thank you. Thank you, because without all of you, every single person involved, this would not happen today.
Thank you so much, Oklahoma. We did it.
We did it. Like, yay.
Yes.
We can celebrate. Carly, thank you for being a great advocate, a great policy expert. Emma, all of those individuals at OK Policy and across the state. I just, again, say thank you for this effort. And let's keep up the good work. Get people signed up now. Got to get people signed up and make sure they go see a really high quality healthcare professional. We have a lot of them in Oklahoma. They're excited. Doors are open, waiting for patients to come.